Families experiencing heroin addiction in Massachusetts. Massachusetts is experiencing a growing epidemic of opioid addiction and overdose deaths. According to the Department of Health and Human Services of Massachusetts, the rate of unintentional opioid deaths, which includes deaths related to heroin, in 2013 reached levels previously unseen. This was a 273% increase from 2000. Needless to say, there's a great need for intervention. Some studies have shown that family can be a key mediator of experience of treatment. They can be a source of motivation, grounding, and connectedness, or they can be alienating and fragmenting. In the clinical and/or community treatment setting, nurses can teach affected families problem-solving, parenting, coping, and communication skills. In our paper, we examine different ways to incorporate family systems nursing practice in the treatment of these individuals. The Bureau of Substance Abuse Services of Massachusetts reported 85,823 people receiving services and 107,358 admissions in 2014. Demographics show this population to be more than half male, white, non-Hispanic, with an education of high school or higher. The majority of the people were ages 18 to 40, never married, unemployed but not homeless. More than half reported needle use over the past year, and more than half have never required mental health treatment. According to the CDC, heroin deaths nationwide rose from 78% to 172% from 2009 to 2013. These numbers correlate with Massachusetts' heroin deaths. In 2013, opioid overdose was the second highest cause of death in Massachusetts, next to alcohol-related deaths. In Massachusetts, there were 978 opioid overdose deaths in 2013. In addition to this, there were over 2,000 hospital stays and more than 4,500 emergency room visits for non-fatal overdoses. As you can see, there is plenty of opportunity for nursing intervention to help these victims and their families.
Now I'm going to talk a little bit about incidence-related health. Injection drug use plays a significant role in the transmission of viral and bacterial disease and is long recognized as an important public health issue. While there has been progress in addressing some of the health issues confronting injection drug users, there remains a broad range of unmet needs and strong evidence that some critical health risks are worsening. So some of these health issues confronting the injection drug users are bloodborne infections such as HIV and hepatitis, skin and soft tissue infections, endocarditis, drug overdose, violent victimization, sexual health including sexually transmitted infections, and mental health issues. Now I will discuss the social systems problems pertaining to heroin use. Besides health problems, heroin use can also cause many problems in society, such as families being broken up by the drug use. In relationships, heroin can cause domestic violence, child abuse, and risk of sexually transmitted diseases. Heroin use is linked to financial problems among families, and studies show that poor people spend a greater percentage of money on acquiring drugs than middle class and upper class people. Of drug users in the poorest 20% of the population, most use heroin. The poor also represent half of all drug users. Heroin use is also linked to an increase in crime. Not only are the manufacturing, possession, and selling of drugs a crime, but drugs can also cause users to engage in risky and illegal behavior. In order to pay for their drug habit, heroin users may resort to theft. Many people who are arrested for a crime are also under the influence of drugs. In addition, drugs are often connected to weapons, violence, and terrorism. Heroin use can also affect unemployment. Drug abuse can keep one from seeking employment, as many employers test for drug use before hiring employees. And for those who already have a job, drug use can impair one's performance at work. Opiates such as heroin can decrease activity, impair motor skills, and cause sudden mood swings, even when used in small amounts. Increased time away from work through absences and late arrivals is also common among those with drug addictions. Disciplinary problems, drinking while on the job, and being fired are also common among heroin addicts. The first article that I'm going to discuss is Adolescent Addiction and Delinquency in the Family System. The researchers sought out to examine the behaviors of addiction and delinquency within the framework of family systems theory. Based on the researchers' review of literature, she found the following. In alluding to an increase in dropout rates among adolescent drug users, an overall decrease in the use of drugs and alcohol except for adolescents, a correlation of juvenile crime with 5 factors: poverty and hopelessness, child abuse, availability of weapons and alcohol, glorification of violence in the media, and single parent families. She also found that there's a high correlation of learning disabilities and juvenile crime. Violence is a learned behavior in early childhood. Problem children come from problem homes and neighborhoods. And links were made between juvenile delinquency and parental, criminal, and mental health problems, lack of parental supervision, and parental discord. The author uses Bowen's family system theory in her discussion of application to addiction and delinquency. She notes that the research conducted in FST and addiction confirmed the presence of high levels of fusion, poor differentiation, and rigid behavioral patterns. In regards to addiction, the abuser of the family underfunctions while the rest of the family overfunctions, which allows the abuser to remain dysfunctional while the remainder of the family remains stable. The author concludes that while it's possible for adolescents who come from abusive homes who lack the predisposing factors can certainly develop a chemical dependence, it's also equally as likely that neither an abusive home nor predisposing factors can lead an individual to become chemically dependent. She goes on to say that while either is possible, it's more likely that an individual who comes from a dysfunctional family and has predisposing factors will develop delinquency and addiction. With regards to the implications of the study, the author states that treatment involves the entire family is necessary. Family stressors, patterns, and coping skills must be assessed. Educating the family and the juvenile can reduce family guilt and anger. Family systems principles of reducing systemic anxiety and conflict make it necessary for the adolescent to act out the anxiety. Just as many of the factors that contribute to juvenile delinquency and chemical dependence lie in the family of origin, so do the elements of recovery. The second study that I'm going to discuss is the perceived conflict, sibling position, cutoff, and multi-generational transmission in the family of origin of chemically dependent persons, an application of Bowen family systems theory. According to Cook, Bowen family systems theory is one means of assessing and treating the chemically dependent individual as individual function is learned within the family of origin. Bowen's differentiation of self is an individual's ability to separate thinking and feeling states, an ability to behave in a thoughtful rather than reactive manner. The ability to thoughtfully act mediates the effects of anxiety. Differentiation is learned from the family of origin and does not shift greatly over generations. Poorly differentiated families which are fused, lack the capability to deal with anxiety and results in the use of 3 specific mechanisms to deal with it: marital conflict, dysfunction of a spouse, and projection of undifferentiation onto a child. Substance abuse serves as a possible mechanism at work in the dysfunction of a spouse or a child's response to projection. Thus, as anxiety increases, chances of substance abuse and/or chemical dependence increases. The study identified other concepts that put one at risk for chemical dependence, such as sibling position, which can have an influence on behavior. Oldest, youngest, and only children are at highest risk for dysfunction, with the oldest tending to overfunction, the youngest underfunction, and the only child most likely the object of projection by the parents. Cutoff refers to the process of distancing from the family of origin when fusion is too intense. The cutoff can be physical, moving a distance away, or emotional, violating family norms so as exclusion from the family may happen. As differentiation decreases over generations in a highly fused family, the pathology increases. Bowen viewed this as multi-generational transmission, otherwise known as the downward spiral. In addition to differentiation, characteristic behavior and patterns are also passed down. In the study, interviews were conducted with 36 chemically dependent participants in outpatient recovery and used to construct a genogram that depicted family structure, relationships, and patterns of interaction within the family, and chemical dependence information across generations. These individuals rated their conflict in family of origin as higher. There was evidence of cutoff where information was not known on one side of the family or there was separation by distance. Highest risk sibling position was the youngest child. And lastly, almost all participants had family histories of drug and alcohol abuse across all generations. However, there was no downward spiral or differentiation with increased use of drugs and alcohol, just patterns of use. With regard to the implications, Bowen Family Systems Theory is a useful assessment and treatment tool for chemically dependent individuals. It not only allows the individuals to assess their family of origin for the mentioned concepts that put them at risk, but it also allows the advanced practice nurse or anyone providing treatment to counsel and teach. Using Bowen's family system theory helps one to reframe addiction as a behavior that can be changed. Directions and implications for practice. In general, the advanced practice nurse is an important component of any family system. Family systems theory views the family as a whole. What affects one member ultimately affects the entire family. The goal of the advanced practice nurse is to assess and identify what affects the ill family member and how that illness affects how the family functions. When it comes to addiction, many aspects of the family and their environment should be assessed. A comprehensive assessment of both personal and family history should be obtained in order to better understand and help provide treatment for the affected family. As evidenced by research obtained throughout the literature review, addiction cannot be attributed to just one underlying factor. Many times, more than one cause can contribute to the dysfunction. Bowen Family Systems Theory is a useful assessment tool for chemically dependent individuals. These individuals should examine their families of origin to look for patterns of behavior, as well as observe for sibling position, family conflict, cutoff, and multi-generational transmission as risk factors for chemical dependence. This information can also be used for treatment, counseling, and teaching. Choosing not to react with rigid family patterns or reconnecting with family from whom one has been cut off can potentially prevent conflict and potentially chemical dependence from being transmitted through another generation. Using Bowen Family Systems Theory helps one to reframe addiction as a behavior that can be changed. Given that addiction can have many causes, it's imperative that the advanced practice nurse view the family unit as one, with treatment geared towards treating the whole family. As evidenced by the research, families don't just attempt to fix the problem, but they can quite often be the cause of the problem. The underlying issues need to be identified in order for there to be an improvement in the current state of the ill family member. The advanced practice nurse plays a therapeutic role in counseling families on how to solve problems and or change behavior. One of the most important roles that the advanced practice nurse can play when counseling is to be supportive and non-judgmental. With many illnesses, but most certainly substance abuse, there are many stigmas associated with it. Providing a non-judgmental environment where the patient and the family feels comfortable can help the advanced practice nurse to achieve the therapeutic, trusting relationship that is necessary to be successful in the treatment of substance abuse. The advanced practice nurse provides teaching in regards to wellness, illness, relations, and parenting. In times of illness, it's very easy for patients and their families to be distracted. In this environment, advanced practice nurses can serve to clarify and interpret data for clients when more assistance is needed. The advanced practice nurse should also take into consideration that the sole focus of treatment shouldn't just be the illness and how to get better, but rather finding the positive qualities that the patient and the family possess in order to provide a caring environment that allows for growth. Focusing on the negative characteristics can further deter a patient and their family from seeking treatment. There are many roles that the advanced practice nurse can fulfill in regards to leadership and administration. He or she can serve as a role model, case manager, advocate, environmental specialist, surrogate, coordinator, collaborator, liaison, consultant, and deliverer and supervisor of care, just to name a few. Being an advocate for a patient is one of the characteristics that separates advanced practice nurses from other providers. The family should be empowered to speak with their own voice, and when they are unable to, the advanced practice nurse should be the voice for the patient to ensure that the patient is receiving proper treatment. In conclusion, the research shows two major points pertaining to what effect the family has on substance abuse. It can play an important role in the development of substance abuse problems, and it can also play an important role in overcoming those substance abuse problems. Given that the family contributes in both the development and treatment of substance abuse disorders, it's been concluded that these patients would benefit from a family systems approach to treatment. Simply stated, Cook, one of the authors that we used in the literature review, states that just as many of the factors that contribute to juvenile delinquency and chemical dependence lie in the family of origin, so do the elements of recovery.